Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the mild cavus foot, a medium arch foot. And we're going to do that through the 4 questions again. So what is the neutral foot or the mild cavus foot? It is a foot where it has the moderately inverted heel. So you got the heel slightly turned in and the rest of the foot's kind of neutral. And what that's creating is lack of pronation. The subtalar joint doesn't allow it to pronate, and so you get poor shock absorption, and you walk on the outside of the foot all the way up until propulsion, and you kind of push off the medial side or the inside of the great toe or the hallux. And because of that, you're going to actually get calluses to the hallux, and it's a pretty significant way of walking in the United States. They found that it's about 25% of the population in the United States. It's a little bit higher in Utah. We're actually finding that we see a lot more people with C than 25%. Typically, this is a pretty good problem, pretty significant deformity in some individuals. So why does it happen? Again, as with other gait patterns, it's actually inherited. It's the way that the foot functions, the way that it's designed, it's the way that it is developed, and can produce pretty significant symptoms such as hip pain, bursitis on the back of the heel or retrocalcaneal bursitis, Haglund's deformity, iliotibial band syndrome, and pinch callus, of course, on the hallux. And then a lot of times you can have an equinus, which is a shortening of the Achilles tendon in that area. What can you do for it at home? Truthfully, if you have no pain, you don't have to do anything. If you're starting to have some of these symptoms, some of these pains, then you need to do some kind of an insert, some kind of an orthotic. The big thing you want to make sure is you don't go to a motion control shoe because it will make this problem worse. You may want to use ankle braces when you're doing significant physical activity to prevent ankle sprains. But ultimately, the best thing to do is to go be seen by a physician that can evaluate the way you walk and get you into a semi-custom or custom orthotic that will change the way that foot functions. The goal being to get you back to normal activities without pain, without deformity, and to put you back into a more natural gait pattern so that it's functioning the way you're supposed to. You get the normal shock absorption, and it decreases some of the stress on the joints. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 171. Sorry, I forgot. This is day 171.